Now, there's a groundbreaking new study which has found a strong link between racism and chronic poor health conditions for Black and brown communities in America. A team of researchers conducted the first of its kind study in Durham County, North Carolina. And what it found was a correlation between markers of structural racism, such as income, education levels, and locations of housing, and a higher prevalence of illnesses like chronic kidney disease, diabetes, and hypertension in the community. In simpler terms, factors like high unemployment and subpar educational levels actually play a role in health outcomes. Historically, Black and brown individuals already suffer from disproportionately higher rates of these conditions compared to other ethnic groups. This compounds the issue. The goal of the research is to eventually develop interventions that can enhance community health. For more on this, I'm joined by Dr. Ebony Boulware, the senior author of that study, which was published this week in the Journal of American Medical Association's open access platform. And also with us is Dr. Uche Blackstock, founder and CEO of Advancing Health Equity. Dr. Blackstock also has a book coming out next month called Legacy: A Black Physician Reckons with Racism in Medicine. Thank you both for being here. Dr. Boulware, this is a super important study. I have long since said that racism in many respects is a public health crisis, and now we have the data to actually support that. What was the impetus that led you and other researchers to tackle this topic, and why did you choose Durham, North Carolina as your testing ground?
Well, Charles, thank you so much for having me. And before I get started to answer your questions, I just want to give a quick shout out to my collaborators, Dr. Danushika Mahatage at the Institute for Health Equity Research at Mount Sinai, Drs. Tina Davenport and Nupin Bhavsar at Duke University, and many others at Duke, as well as at NC State University, Northwell Health, and Wake Forest University School of Medicine. We did seek out to understand the relationship between structural racism and health, because we know that ethnic and racial minorities have much worse health than others in the United States, including higher rates of chronic conditions, acute conditions, and earlier death rates. So what we did was study over 260,000 North Carolinians who lived in 150 neighborhoods in Durham County, North Carolina. And what we did was measure structural racism in their neighborhoods and measure their health. And we defined structural racism as factors which work together to create discriminatory conditions in neighborhoods that disadvantaged ethnic and racial minorities. We looked at 16 factors, which included the neighborhood racial composition, education and employment rates in the community, income and poverty rates in the community, criminal justice, housing, voter participation, and even the amount of green space and tree cover in a neighborhood. And what we found, in short, was that if there was more structural racism in a neighborhood, the health of the neighborhood was worse. So if you had higher structural racism, you and your neighbors were more likely to have higher rates of kidney disease, diabetes, and high blood pressure. These are three major conditions that we're fighting against in the United States, and major conditions that we know that ethnic and racial minorities suffer worse outcomes from. We chose Durham because sorry. You asked me about why we chose Durham, and I just wanted to say Durham, North Carolina has a huge range of living conditions, all the way from severe poverty to extreme wealth. And so provided an opportunity for us to look at this for the first time, and then to take several different types of data that were available and from the community, public records on income and poverty, criminal justice, but then also compare those to health records that had been made publicly available by the county public health, so that we could look at neighborhood health.
Dr. Blackstock, this study, it defines structural racism as the means by which societies perpetuate discrimination through interconnected systems, including housing, education, and unemployment. Can you clarify for our audience how the prevalence of certain factors like inadequate housing and schools, and even the quality of nearby medical facilities, they are all indicators of structural racism, which can then negatively affect these actual health outcomes?
Yeah, thank you so much, Charles, for having me. An honor to be on with Dr. Boulware. Thank you for this study. It's so important to informing what policymakers need to do. I think so often we think about health as individual choices that patients make. That patients make. And instead, we really need to understand how practices and policies, the legacy of slavery, the legacy of Jim Crow, current day systemic racism impacts the health of our communities. So when we have people who have housing insecurity, who live in food deserts, who live in communities where there's not enough green space for them to walk around or to work out, where they're not able to find gainful employment, where they're not able to have quality education, we know that racism is a key driver of what we call the social determinants of health. And what we see in terms of health inequities and health disparities are the downstream outcomes of those. And so I think it's so important for us to connect the dots. The dots that need to be connected are that, individuals are only responsible for about 20% of what makes them healthy. The other 80% are these systemic factors that Dr. Boulware and her colleagues studied in this very, very important research that needs to inform how, communities and resources are given. So, for example, we have seen a chronic disinvestment in Black communities and communities of color, which have led to these poor health outcomes. So the results that, Dr. Boulware's study showed really needs to inform policies that impact health on a more holistic level. So it's not just about what medications a physician prescribes or a health professional prescribes. It's about what is the prescription for making a community healthier? What will allow it to have higher quality education, better job opportunities, more green space? All of that is critically important. And I'm so glad that we are now discussing those factors instead of what happens inside of an exam room or a clinic room, because we know what happens at the community level has the highest and most significant impact on the health of our communities. And our communities deserve that. Because of discriminatory housing policies and other racist practices, we are seeing what we're seeing now in terms of these high burdens of chronic disease in our communities, diabetes, high blood pressure, chronic kidney disease. Essentially, it's killing us. And so I think that there's an obligation for policymakers at the local, state, federal levels to partner with community organizations. I think also for healthcare institutions, there's an obligation for them as well to really look at what strategies do we need to employ to mitigate how the impact of the legacy of systemic racism, past and present, and what's happening even current day in our communities.
I want to follow up with you about your book, because it is both a family memoir and it is really an unflinching critique of the American healthcare system. It looks at the widespread health disparities that are faced by Black Americans. Now, your mother was a doctor, and so is your twin sister. What has changed over the years and what hasn't in terms of how the medical field plays a role in reinforcing structural racism?
Yes, I mean, it's so rare for me to be able to say that I'm a second-generation Black woman physician. And saying that, I'm proud of that, but that also is a consequence of systemic racism. That's why I can say that. But also what I will say is that a lot of the inequities that were present when my mother was still alive have worsened today. The Black maternal mortality rates are even higher now than when my mother gave birth to me. So that is a problem. That is a significant problem. We're seeing how pervasive the impact of systemic racism is. And we need our healthcare institutions and our healthcare systems to be active participants in addressing that they cannot be passive about that. We need to have, it's not just trainings on unconscious bias and how to be anti-racist. This is about putting practices and policies within our healthcare institutions so that we don't perpetuate the systemic racism that Black people and other people of color face outside just living their daily lives. So we need healthcare systems really to step up and provide culturally responsive care, quality care to Black people and other people of color in our communities.
This is such a critically important conversation and something that I could talk to you both about for a lot more, but unfortunately we're out of time. Dr. L. Ebony Boulware and Dr. Uche Blackstock, thank you to you both for this important discussion on policy, health, and structural racism.